Hi, everybody. This is Carmen DeValis, and I am the host of Experts Dig In for Doggies for Dementia. Doggies for Dementia is a nonprofit that I founded with a mission of raising awareness for those impacted by dementia and related disorders. And we also provide really wonderful experiences for family. We tell our stories with photographs and video. Today, I have a really special guest, and we're going to talk about some really current event stories that must get out. And Carrie Leljedal is here today to tell us her story, and I am incredibly grateful. So welcome, Carrie.
Thank you.
Yeah, I know you have we're going to talk about your son and what has happened since COVID-19 for you. But I'd like for you to give our audience an intro, just, tell us about your son and what your story with your life, your son, and what's happened so far.
Okay. So I have a 32-year-old son named Lynn. He was born with a rare seizure disorder called Sturger-Weber Syndrome. It is where a port wine stain penetrates the brain, and the brain can calcify, it shrinks some, but it definitely, seizures are the big problem with it. It's also progressive. Most people that have Sturger-Weber have an intellectual disability. They can have glaucoma. There's the host of things that can stream down is humongous. But my son has bilateral involvement, so he's involved in both sides of his brain. When he was younger, his seizures were very different than the average. We would go 2 years with no seizures, and then we would be in what's called epileptic status for weeks, if not months on end, where you're having, either extensively long seizures, 3 and 4 hours at a time, or having 80 and 90 a day. And we've done it all. When he was 16 years old, the seizures had gotten so far out of control that we had to look at surgical options. And we disconnected the right hemisphere of his brain. And so he truly only functions with the left brain. The right brain is still physically there, but it has no function. It is just there. Because he has bilateral involvement, he still has seizures today. They're not as severe, but they still compromise his life.
Sure.
The effects from the surgery are humongous. He has your short-term memory is a right-sided brain function. So he has very little to no short-term memory. If most people look at him and presume he's had a stroke because he is compromised on the entire left side of his body. He has a visual field cut on the left side of both eyes because you see out of a prism. So if you affect the right side of the brain, it affects the left side of each eye, and vice versa. And he's, like I said, and it's cognitive. His IQ is a little lower. It affects everything.
Yeah. So how is his care then? I mean, is he living at home? What's the situation for you?
So he lived at home until about 7 years ago. He lives in what's an ICFDD, which is an intermediate care facility for adults with developmental disabilities. It's skilled nursing. It's around the corner from my house, which is fabulous. And prior to COVID, it was a perfect solution because I could be there 10 times a week if I wanted, or 4 times a week, because when it's around the corner, you can run in and out all you want. He could ask a staff person, hey, will you take me to my mom's? And get in his electric wheelchair, and they could roll over. That was all prior to March 9th.
Yeah.
Since March 9th, it's a totally different scenario.
Right. So living that close, I would assume you were able to visit a lot. Were you still working and visiting, or how did you work that out?
So even when I wasn't,
yeah.
Even when I was working, there were days I would stop on my way to work and drop him off donuts, or come by after work and, let's take a walk, because the more he's on his feet, the better he is. And the mobility is one of the biggest issues for him. And if you don't use it, you lose it. So pretty much any time myself or my husband was there, we had him on his feet and we had him walking.
Okay. Wow.
And, you know, COVID has complicated lots of different things.
Okay.
You know, families are not allowed access to their loved ones.
Yeah, we're going to definitely talk about that, because that's a real key issue right now. And definitely, I know you've had a strong voice in this as well. And so in the last, and even even a year ago, you started to note a decline, and you were even there more. Yes.
Yes. Last year was really, we had a lot of complications and new medical issues arise. So he lost a lot physically. We probably had 45 ER visits from seizures. So between the seizures itself and the emergency medicine used to stop seizures, which is, you know, are all narcotics, they sedate you. He lost a lot. So the aspect of him being on his feet, doing things with his hand, with his one hand that works well, anything to, you know, encourage him to move, use the body parts, whatever, is really important. And because of COVID, I am not able to go in and do it because family members were not allowed in. People have been isolated to their rooms for the most part since March. So even when they say, well, yeah, we've been trying to walk them, but they're walking them 11 feet from the desk or his bed to the bathroom, where I would walk him all 4 halls in his building, which is probably 1,000 feet. There's a humongous difference.
A big difference. So with lockdown, you're not able to come in at all. And I want to talk about who decides who can visit, who can't, how it's done, what kind of lockdown, because I've heard a variety of stories.
It is a variety. So in the beginning, the governors all issued shelter-in-place orders. They closed down the facilities. Right behind that, CMS, which is Centers for Medicare and Medicaid, issued a guidance that was put on all facilities, regardless of whether they normally fall under CMS guidance or not. 0 visitors, no therapy, no outside labs. If you were not employed in the building by the company that runs the building, you were not in the building.
And so we're hearing then from state and federal, but not always congruent.
And they're not cohesive.
Yeah.
There's no cohesiveness from federal to state. There's no cohesiveness from state to county, because basically it falls that the federal government makes a guideline, sends it to the state looks at it and says, ooh, we're going to do this and this and this to make it stricter. They can't make it weaker. They can make it stricter. They then send it to the county or the city, depending on how the local health departments ran. They look at it and say, ooh, we're going to do this and this to add to it,
right,
to make it even stricter, so that way we're not the one catching the heat. Then you send it to the facilities, who are incredibly walking a very thin line of, if I don't do this exactly right, that the federal government can hold my federal funding, the state can fine me or hold my state funding. So I'm going to add this and this rule on top of the other 3 sets. And by the time you're done, there's not a single person in these buildings that is having their rights looked at, because they're trying to protect them, but they're violating rights, and they're missing that this needs to be, look at the patient. What does the patient need, or the resident, however you want to phrase that, and make sure we are still caring for them. And in this shuffle of protection, we're not looking out for them.
Yeah, yeah, and I think that when we're focusing on physical safety as well as all the other factors involved, which are that who do you follow, state or federal, you don't want to get fined, heaven forbid for the communities when they do have COVID in the building, that as far as how things look to the outside community, does that mean that facility is not clean? Are they not taking care of the what happened that they got that even though there's a pandemic going on and it happens, and no families are
Right.
allowed in, right? So it's not the families that are bringing that in.
So that is where some of this issue comes. That was why the facilities were locked down. We're going to keep everyone safe by not letting anybody in. But they overlook the fact that every employee goes home at night. They have families. They have to go to the grocery store. It's been almost 9 months. So they all have quarantine fatigue, whatever, however you want to phrase that. So yeah, maybe for the first month or so, the staff in any facility was really doing a good job of social distancing and masking up and doing everything they needed to do. That was fine in March. It's almost Halloween, and all anybody wants to worry about now is how am I taking my child trick-or-treating, and how am I getting my family together for Thanksgiving? So because people have to live a life, COVID has come back into these buildings. It came into these buildings. It was really not preventable. No matter what was tried, keeping it out was going to be virtually impossible. So we've proven it. There's statistical proof this isn't working. So why are we still doing it almost 9 months later? You know, I live in a state that cannot even come up with a current set of guidelines for most of the facilities to use. We're still running on guidelines that were issued in like July, where pretty much every other state is running on guidelines that have been issued in the last 21 days or so.
Yeah, and then I do think it's a lot easier to say, we want to protect our elderly and vulnerable in the communities. And the best way to do that is to lock it down, but that's not looking at all the other variables around that, including that, you know, there's family-centered care with a lot of family members, right? I mean, whether it's called that or not, it is. Families are there. They're the eyes of the ears. And I'm going to ask you to speak about that because I know you're very active with that. And not to mention the emotional impact for your son, for instance, to not see you and wonder where you are because they not always able to understand what's happening.
Right. And I tell people, I'm lucky. For the most part, he does understand, but you have to remind him over and over again, partially because of the short-term memory issues. But it's prior to COVID, the longest we had ever gone away from each other was 9 days, and I was in the hospital. So this was not, so that's where family-centered care even becomes more important. So there's a lot of correlations, and I hope if COVID changes any one thing, it changes the medical culture. There's a huge correlation between how pediatrics is and geriatrics. And even, you know, if you put the people with developmental disabilities and those kind of illnesses in with that geriatrics, if they were running this and caring for them in some of the same manners that pediatrics does, which is using a family-centered approach. That if we're talking, okay, what does my son need? And there's myself, and there's doctors, and there's nurses, and you have a team of 10 people sitting there. In geriatrics, that team of 10 is making the decisions. In pediatrics, that team of 10 is actually a minimum team of 11 because mom or dad are there, and their opinion is as important, if not more, than the doctors, than the nurses, because they're the historian. They understand what's wrong with their loved one. They've been there, they've been through it. They're the one who knows that, yes, we tried medicine XYZ 7 years ago, it did not work. Where, yes, they have medical records, but the team with the 10 for the geriatric population cannot go back through 60 years worth of charts.
No.
But if you talk to their son or their daughter or their spouse, they know what has been tried. They know what's worked, what hasn't. They know that if you explain it to my dad this way, he'll understand it. But if you do not explain it exactly this way, he's not going to understand it. He's going to get frustrated. And then you're going to see the side effects of that frustration.
Yeah, I have heard so much that the buzz is like, well, I know the families need and want this emotional, they have an emotional need to see their loved one. I'm like, oh, it is far beyond, not to say that's not important, because it is.
Correct.
That lack of connection is an emotional toll, and research supports it causes physical decline dramatically, and it's a basic need.
So right now, I read a statistic this morning that the unexplained death in the United States, from year to year of wasn't a car accident, wasn't this, is increased this year 37%. And that's after taking COVID numbers out. Dementia, Alzheimer's, all of that is pushing close to a 30% increase from last year to this year.
Mm-hmm.
And when you talk about the historian, what can they do to help prevent that? Mm-hmm. It's a very strange example, but I can give you one. So my son, like I said, was born with a port wine stain. It's in spots all over his entire body.
Tell us what that means, because some people won't know what that means.
So a port wine stain is a pinkish red, can be very dark purple birthmark. And like I said, his penetrated his brain, which is what caused everything else. So he has it on the small of his back and the top of his rear end. So the number of people when you're in a medical setting that, because they'll be in a gown or something and all of a sudden will catch hold of that and see it, they're like, oh my God, he's got this huge bruise, or what happened? No, it's a birthmark. But without somebody there to explain that to them, first of all, the assumption that people make of what it is versus what it truly is so far out of the realm. So then you have things like, someone's going to call either child or adult protective services because they think the person has been abused or neglected. No, that's not the case. Mm-hmm. Your dad fell in the facilities and needs 6 stitches, but they were doing it right. But because he's in a facility, he's now being sent by ambulance by himself to an ER without the support to make sure that the ER knows, first of all, he's allergic to codeine, so we better give him something else for pain before we...
Yeah, I mean, it is not unusual for someone to go to the emergency room if they're by themselves to not even be able to explain how they're feeling or what's happening, where that family voice is there to say, this is what's been happening, this is what's been going on, and this is what we see that tells me they're in pain or whatever it might be. Right. That's an essential role. That's not it would be nice if the family was there.
No, it is beyond essential. So yeah. The Office of Civil Rights, somebody filed a civil rights complaint in May. Somehow it got expedited, thank God. And in June, the Office of Civil Rights, through HHS, actually put a judge, an early case resolution judgment saying, and this was against hospitals in Connecticut, saying that anybody with a cognitive, intellectual, or developmental disability is always entitled to have a support person with them. Mm-hmm. So a lot of the states, Illinois being one, has issued guidance along the same lines, preventing them from being sued or anything else. But what doesn't make sense with this guidance is it clearly states medical facilities, support person can be there. Why are our nursing homes, our ICFs, our pediatric ones? And that's what people don't understand. There's close to 500 pediatric long-term care facilities in the United States. The majority of them are not allowing parents in either. I've talked to moms that have been 6-7 months without touching or seeing their child.
Yeah, I don't think this has been yelled. No, I know you have been speaking it, and
Yes.
you've talked to radio, news programs, newspapers, articles, and things. And yet, with all the other things that are going on, it doesn't really rise to the surface for a lot of us. I think unless you're experiencing it. And I would really like to know how this has impacted, what does this feel like? I mean, I'm putting it in my head. My son is in his 30s, and he's well, but in this situation, and I am having a hard time with that because I'm not experiencing it. But from your
It's
standpoint,
gut-wrenching, heartbreaking. So like so the lockdown started in March. My son's facility, who does a really good job, but I probably should say that more. They really do. They love the residents. They're doing everything in their power, but their power only goes so far. So late April, early May, COVID found its way into the building. That first day after they called and told us, we have, and it started obviously with the staff. They had 3 staff positive. They had a few residents that were symptomatic that they were testing. And I was hysterical. And my son's used the same neurologist for over 15 years. So we're friends. And I called her and I didn't get her, and I left her this voicemail. And by the time she was done listening to it, she was more worried about me than she was him, even at that point. Because I was beyond rational.
yeah.
All I could see is here is this awful virus that is killing people. My son is locked in a building that at that point, families weren't even being given end of life visits.
So
And
that means if it looked like it was the end of his life, you would not be allowed in at all.
Correct. Families were being told at that point, there was still this conversation that hospitals didn't have enough ventilators and all the rest, and that hospitals would probably be having to make choices of, I have 2 people and 1 ventilator. So here I have a 32-year-old that is healthy, has children, and has responsibilities. Here I have a 32-year-old that's developmentally delayed, who is dependent on the system, doesn't have the same life, but so we're going to choose which one is this more beneficial to. And at that point, they were afraid they were going to have to look at it by the life of the person instead of, okay, this one, the other person is actually sicker and they need it more, but their survival chance is less. Thank God it didn't come to that. I mean, from where we live, there are a lot of small rural hospitals until you cross over the river to go into St. Louis. It was one of the first things I did was, it's on my son's chart now. If he got COVID, they were not allowed to take him to a local hospital. They must take him across the river to a university hospital, because I knew, especially in a university hospital, that wasn't going to happen.
Mm-hmm.
It's the difference of the size of the hospital and the treatment. But
Right.
no family should be worrying that my loved one's going to die because they're competing for the same medical care as everyone, because nobody should be competing for this.
That's a lot of worries to pile upon. You're worried that even his condition itself was declining before COVID. Now we have isolation, lockdown. You're not allowed to see him. You can't see him, and then there's the COVID worries, and not just COVID itself, but then what would happen if he gets it and he needs hospitalization. Even that's another hurdle too. And you cannot you're not involved in, I mean, your input is how valuable in that case? Did you feel like your input was valuable?
So, and that there were months that I felt like everyone had taken away my ability to do anything for my son because, it started with, first of all, every doctor's appointment was canceled for over 4 months. So we didn't see any of the doctors. So we have all the health issues that are like compounding because he shouldn't go 4 months without being seen by at least one doctor, if not 5 of them. And then you have the facility who's doing the best they can, but they're communicating with the physicians when they can. They're not always making sure that, not always at their own fault, but a lot of times the communication breaks down from the physician to the facility to the guardian or the medical power of attorney or parent. So, it's a game of telephone.
Right.
And when you
crisis going on, right? We've got a lot of stuff happening. How easy it is to drop something, gets dropped from the list of communication. You make the call, you leave a message, you don't hear back, but there's no follow-up. There, things are easily lost.
Exactly.
Yeah.
I mean,
and I know the communities are working shorter staffed. If someone is sick, they're out
Correct.
until they can prove they don't have COVID to come back, right?
Correct.
Yeah.
Correct. I mean, I had a nurse call me one morning, and they always start out with, but he is okay. So, as soon as they say that, your brain is like, okay, what's wrong? And she's like, he just had a seizure. She's like, but I've never seen him have one that looked like this. Okay, tell me what it looked like. Yeah, that's interesting, and that's definitely different. But now you've really sent me in the wrong direction because, yes, I needed to know this, and I need to figure out what do we do next. But I can't do anything because I can't go in. Yes, I can call the neurologist, I can send emails, but until I walk in and I look at him, because if the doctor can't, I should be the one doing that, but you can't. You cannot make that assessment through a window visit. Trust me, I've tried. Anybody who considers a window visit as anything in person needs to try to do that because it's not.
It's not. How have you coped? How have you coped personally?
In the beginning, not well. Then I put a lot of energy and effort into a big garden and just buried myself in the garden, really. And then I met somebody who told me about Caregivers for Compromise on Facebook and told me, look at this. So I went and looked at it. And I found somewhere to put my energy. A lady by the name of Mary Daniels in Florida was essentially in the same situation I was, except for that it was her husband with dementia. And she was no longer allowed in. And she wasn't going to accept that. And somehow managed to convince her husband's facility to let her work as a dishwasher. And when she took the job as a dishwasher, it allowed her to see her husband, which in most facilities actually wouldn't have happened. Because in my son's facility, if you're in the kitchen, you're in the kitchen. You have zero contact right now with residents. It didn't used to be that way, but that's COVID.
Right.
I mean, their building is very strict about where you work is where you work. You don't crisscross. So most facilities that wouldn't have done a family member any good anyway. Mary got some really good publicity out of this somehow, and People Magazine picked it up. And then she started Caregivers for Compromise. There's now an active group in every state.
Right.
And I got involved with them, and somehow now I've actually become the spokesperson for Illinois of this. And we've been to the Capitol and protested. I've done numerous TV, newspaper, radio interviews. I've met with legislators. Our biggest problem in Illinois is that our governor and our director of public health will not meet with any of us. They don't want to discuss it. It's their way or no way.
Yeah. So, okay. I'm just thinking to myself, like, I don't know if I would either be wrapped up in tears, wrapped up in things to do, and not sleeping, just not sleeping.
Exactly.
And just, you close your eyes. It's like, well, what am I going to wake up to? What's going on? the fear of the unknown is so huge that, and I've heard some say they've used some electronics like FaceTime using iPads or sending pictures. And I don't know if
And
that's,
we're doing all of it.
yeah, yeah.
We're doing all of it, but it is not even close to the same thing. You know, first of all, you can't hug them. You can't kiss them through FaceTime. It's a screen. You know, my son has all the technology in the world in his room. My husband and I have put it there. But there's days, first of all, some days he can turn it on and do what he needs, and other days he has to have help. So then it is, can we get somebody to help him? You know, like I said, my son has a good comprehension, but you take that same technology and give it to somebody with Alzheimer's and dementia, and they cannot figure out why their wife or their daughter or son is inside of a box.
Oh,
why aren't you here?
right? Yeah, yeah.
Okay.
Right. And outside the window, it's like, who's that coming up to my window, and why are they wearing a mask?
Well, that's been something I've been very vocal about with window visits. Probably one of the most important person that comes in any building is an ombudsman. They are a neutral party that is oversight to make sure residents are cared for, residents are getting what they need, their rights are not being violated, their objects aren't being stolen, all these other things. Ombudsmen have been removed from the buildings also. So they had the ombudsmans doing window visits. So I'll give you the description of what I picture here. Is your ombudsman with a mask standing outside of a window of a 92-year-old little grandma, and he's trying to ask her questions that she's like, I don't know who this person is. Why are they doing this? And if you actually found a resident who had a problem and was willing to speak to the ombudsman, the odds are there was a staff person sitting there trying to help facilitate this. So in turn, that person is not going to speak up.
That's right. Because window visits are supervised, right? I mean, window visits are
majority, yes. And all visits right now. And that's the other issue. CMS guidelines have clearly stated now visits do not have to be supervised. There are circumstances they need to be. If a resident, you know, especially in what setting you're in, you know, if you're dealing with people with developmental disabilities, sometimes you'll have a resident that's a runner. Then you'll probably need supervised. But that supervised does not have to include, I'm sitting 2 feet from you and you cannot have a private conversation.
Right.
But that is what is going on.
So
I describe the visits as prison visits. A 6-foot table, a piece of plexiglass down the middle. My son was on one side, I was on the other. A staff person was at the end of the table. And the only quote unquote person that could get close to my son was my 8-pound dog, who went under the table to see him. Because she figured out, I could get around the rest of this. I'm sorry, they're not in prison. They have not broken laws. They have not had their rights taken away. You know, life is not worth living if you don't have quality. And we've managed to give these people quantity, but we've taken away all of their quality.
Right. Yeah, that Unitarian view that is one issue, the health, and that's it, but not looking at all the factors around that is insane. And okay, so clearly you've experienced it, you're researching it, you are so on top of things. I need to take notes on all the latest things I don't know about. I appreciate that. And so what's next? Let's wrap this up. Like, what do we do? Because I had this dilemma. I'm talking to a friend. I say, well, we're doing great raising awareness. We're showing the stories. We've got pictures. We're bringing this issue to light. But then what? Who really needs to see? Who has power to do something?
So CMS and CDC.
So
really, in the end, because CDC is the medical side that gives this direction to CMS, who oversees the financials, and they, you know, it kind of merges because in the end, it all stops with the dollar.
Well, it's a lot of this is money focused. I mean, we know that.
It
Right?
is. And until we can get somebody who has a louder voice than I do, I mean, truly, we need somebody on the lines of a true celebrity, that has this humongous following that is willing to speak up every day of the week, and until they have pretty much guilt-tripped the people in charge to get to the table and work on a reasonable solution of how do we give these people the quality of their life back, how do we give them their rights back, but how do we protect them? I was reading last night of the plans that are being used in Canada. They're fabulous. They're putting plans in for essential caregivers. They're putting plans in for visitors with guidelines that are still protecting the resident, but giving them their life back.
Sure. Yeah, and so celebrity definitely has more clout than we do, so they'll get heard. You've gone directly to politicians yourself.
Correct. I have spoken with and met with, 8 or 10 state representatives and probably 4 state senators. They're trying. In Illinois, part of our issue is they don't go back into session until this representatives go back in session the 3rd week of November, and the senators go back the last week of November, but it's only for veto. And our governor and the speaker of our house has said no emergency sessions. So they've blocked them. The Senate can go back, but it does the Senate no good if the House can't go back. So we could have solved this with emergency legislation, but because our speaker and our governor will not allow that, we can't do it.
So that's what happened in Illinois. Yeah. Okay. Well, we're calling celebrity. We need to call out some celebrities.
Celebrity, some major network who wants to run this on every newscast. 20, every time they can, until somebody really listens. There was a committee that just put out a 180-page report, and there was at least one person on this committee that wouldn't sign off, and he's one of the top doctors as far as infectious disease and elderly and all the rest, because he didn't agree that the ideas and how they were going to implement visitation and all that, he didn't agree with it. They had, 5 or 6 people that signed off but didn't recommend it. That should be a telltale sign that something else needs done.
Right. Absolutely. Well, at the core of this, yes, financials, and it comes down to our core values, I believe. If we truly value people, we really value the lives of our citizens and of those we love, and all equally, supposedly, right? Then there's no way this could ever happen in our country. No way. And instead there's other things happening and getting lost in this informational, like, I don't know, it's like a potpourri of information and politics and finances. And what happens is people are dying alone in their rooms, and families then are suffering huge consequences as well. It is just unfathomable to me. Just unfathomable that this is happening in my lifetime.
It shouldn't. First of all, nobody should die alone. Nobody should die of loneliness or isolation. I mean, I've been speaking with a gentleman that's up in Chicago that's a quadriplegic, 62 years old, that lives in a long-term care facility. And the nursing home he lived in wasn't even allowing their residents to go outside and get sunshine. We finally had an ombudsman help him. So for the first time last week, in months, that he got to actually go outside for 15 minutes to get some sun. This is America.
Yeah.
They're not prisoners.
So if I were to take one more big step forward, what do you think that's going to be? We'll close with that. What's the next big step that needs to happen? I know we have celebrity status. What about
we need a nationwide, universal, essential care caregiver's plan. That way, every resident is guaranteed that at least one person of their choosing gets to come in to the facility safely
Mm-hmm.
to be with them, to give them support emotionally, physically, whatever that person needs. But this way, nobody is alone.
Mm-hmm.
Nobody, things aren't going unmonitored because right now there's nobody watching.
No, yeah,
You know,
yeah.
the cat's away, the mice will play.
Yeah, and it's left up to the for the a lot of times for the community or corporation to decide, and we know how haywire that can go, and it's not consistent. I mean, even across
Right,
town, it's not consistent. Then, and even in small places,
correct.
people are looking, and it's to say, well, let's just take them home, or let's just switch communities. It is not easy, and that
That
too is
is not
harmful.
easy.
Yeah.
And for every one person that has said to me, well, why don't you just bring them home? You- If I could just bring him home, he wouldn't be there to begin with.
Mm-hmm.
You know, there's a reason he's there.
Mm-hmm.
You know, like I said, he's been home for 2-3 day visits. And by the time he goes back, and after I've done it for 72 hours, I need 3 days of sleep.
Mm-hmm.
You
Yeah.
know, and I love my son and I would do anything for my son, but I cannot physically provide 24/7 care. And my husband has to work to support us.
Yeah, it's as if that we're looking at the communities as being holding tanks of sorts, when in fact they're there for care that they need, that, they're more than what families can provide. And
Well,
yeah.
and actually, your description is right. It's not a holding tank, it is their home.
Mm-hmm.
It is their home, and it needs to be treated as such.
Right. And their
And they
home
need
in
to be,
which you arranged it so you were there for him, while you
mhm,
can also take care of yourself, which is essential, because if you're not there, then you're
correct.
a really important part of that picture, of course. And my heart's just breaking here in the story, Carrie, and I know that you're one of many, which is just we just got to do something to make this change. And even a few months ago, people were saying we need to do this because then the next thing, there will be something else. And yes, indeed, there will
Correct.
be. And because of things that are happening, I think we're getting ready for another wave, which is here we go again, and we haven't got this one solved yet, which to me creates panic. My heart rate starts to race when I think, oh no, we haven't got this taken care of yet for families. And then another wave just is going to set you back. And so, and I've even heard this from other care providers, in communities, and say, well, even if we do open it up, it won't be for long, because as soon as there's
Well, and
a
that's
positive case, then
exactly, and that's part of why this needs to be a federal, not guideline, mandate. It needs to be mandated that this is the bare minimum that can be done. You
right.
cannot deviate from this plan. You can change other plans, you can change other avenues, but this is the bare minimum that every resident is entitled to and every resident will receive.
Mm-hmm.
So they are not suffering the way they have for the last almost 9 months.
Yeah, yeah. Well, I so thank you for sharing your story
It's
today.
been my pleasure. Thank you.
Yeah, even little steps make a huge difference, that you just never know who's going to hear it. And we're doing our best. And I really, as I said, I applaud you, because I know then you've put your energy into, let's solve this problem. Let's solve this problem. And we actually met through the Caregivers for Compromise Facebook page. So love it or hate it,
Yeah.
social media can be a huge, huge plus. And and I've spoken with a variety of family members, same thing, who found me that way, and like, let's do what we can. And
And that's exactly it. And right now I'm trying to use social media to my advantage
yeah.
because
Yeah, any way I can help that, I can. And so those of you viewing, you see this on YouTube, please share it out and get it to as many people as you can, because This is a human crisis in our country, in the United States. I know it's not just here, but right now we're talking about our United States, and this is a crisis, and this is a life and death crisis that has been somewhat silenced. Well, I guess not somewhat, it has been silenced, and it's a huge, huge issue. And maybe it doesn't impact you now, but it will impact all of us. And we have to make a change. It has to change. There's no doubt about it. So share out, comment, and help us get this message out so that we can help Carrie and families like hers. Thank you, Carrie. I so appreciate you visiting. And thank you all for watching, and we will catch up with you.